President.
Senator Morgan.
All across our country, in every congressional district, in every corner of every state, families are suffering. They're taking a look at what it's going to cost to buy health care for this coming year. And they're going, wow, I won't be able to afford that. I guess I'll go without. And we know what happens when people go without health care. And this is clearly not something that is a blue issue or a red issue. It's an issue for every family, affordable, quality health care. And I know it's not just a concern held by Democratic senators. It's a concern held by Republican senators. So we have a common desire, Democrats and Republicans together, to address this concern. I think about some of the folks who have written in from my home state, and I know my colleagues on both sides of the aisle are getting the same letters and the same phone calls. Eric in Corvallis got a letter that his insurance premium is exploding from $183 to, get this, $1,588. Wow, that's, well, roughly a seven-fold increase. I heard from Leah in Eugene, whose monthly payment is going from $462 to $1,438. Threefold increase. And Stacy in Lincoln City seen an increase from $1,300 to about $3,200, almost a $2,000 increase. So those stories are everywhere in our country. And there is so much work we can do on health care together. The President has said, let's negotiate on those complex issues after the government is opened. And those complex issues, they may be things like the cost-sharing reduction program. They may be things like, how do we lower the cost of drugs so we don't pay more for drugs than the folks in Canada across the border to the north pay for their drugs, or the folks in England or Australia or Japan. We can work together on strategies to see where there's waste in the system. Or are there scams and scandals in the system? Let's shine the light on them and let's fix them after the government reopens. But let's just do this one piece, extend one particular tax provision that's in law now for this coming year. So there's immediate relief to folks who are getting on the internet at this very moment and going, oh my goodness, I can't afford that. The Erics, the Leahs, the Stacys that exist in every corner of every state. I've been hearing from small businesses, and they've been saying Main Street is Pain Street. Why? Because so many of the small businesses in my state, and I'm sure in every state, go to the ACA exchange in order to buy insurance. And so they're reeling from that impact. They're reeling from other economic fluctuations in the country. And they're saying, can't you figure this out? Can't you figure this out? So I've been hearing from colleagues on both sides of the aisle, we want to fix these tax credits, these enhanced tax credits for people to buy insurance. Well, let's do it. We can open the government today. We can do it today. Today we can address the issue my colleague from Wisconsin was speaking to just an hour or so ago. He was saying people who are working should get a paycheck. That will happen if we pass this today. He was saying folks who are furloughed should get a paycheck. We can do that by putting them back to work, by opening the government today. And then we can negotiate on those complex issues to make this system work a whole lot better, because all of us know that our system is overly complicated, overly bureaucratic, inefficient, and we know that there can be improvements. So let's work on those things together. The proposal that the leader has put forward, the minority leader has put forward, says let's form a special committee to work on those issues and find some proposals to take us to a better place. That's the type of partnership that we need to give encouragement to the American people, that we're willing to work together to solve the challenges that they see every day in their lives at their kitchen table. Thank you very much, Mr. President.